Today we'll be learning about a certain fine gentleman named John Snow. Wait, no, not him, although he is a fine gentleman. Today we'll be learning about the 18th century epidemiologist John Snow, who changed the face of the cholera pandemic and epidemiology forever. He was born in 1813 and moved to London at the age of 23 to start his formal education. The quality of life in London at the time was significantly impacted by the piles of feces and dirt on the streets. This dirtiness of London is exactly what made it a hotspot for cholera. Scientists at the time hypothesized that cholera was airborne, spreading through miasma or bad air, but John Snow theorized that cholera was spread by a germ or microbe present in the dirtiness of London. One of John Snow's most famous experiments, called the Broad Street Pump Outbreak Experiment, set him on the map in the field of epidemiology and gave him the name the father of epidemiology, as his efforts to pinpoint and control the cholera pandemic revolutionized the field. After tracking and plotting the cases of London, Snow found a common point of transmission, which is the Broad Street water pump used by almost everyone in the city and neighborhood. After much convincing, he had the local officials remove the handle of the pump, which rid the city of the cholera outbreak, partially due to the increase of emigration at the time as well. Although centuries apart, the techniques used by John Snow to pinpoint and fight cholera and the techniques used today to fight COVID-19 have many underlying similarities.
COVID-19 is something that we've been dealing with recently. It is, for many of us young people, one of the biggest worldwide pandemics that we've ever experienced. But what did pandemics used to be like? If we go back to the early 1800s, we can see these similarities and differences through COVID-19 and cholera. There have been 7 cholera pandemics since the first one in 1817, the worst occurring in 1854. Back in the 19th century, doctors and researchers didn't know how diseases were spread and didn't know how to treat all these diseases, so infection rates were high, similar to COVID in the beginning. COVID was this new virus that was spreading around and people had very little information on it. There are many other similarities between COVID-19 and cholera. These two diseases spread easily under crowded conditions where people were in close contact for long periods of time. Some patients with these diseases have horrible symptoms while others walk around completely unaware that they're carrying the disease.
Modern epidemiology has been developing since the 1930s as researchers began to focus on both non-infectious and acute infectious diseases. After World War II, the field of epidemiology expanded dramatically to encompass the entire range of health-related behaviors. For example, in the 1940s, epidemiologic methods were used to discover that smoking is linked to lung cancer. Epidemiology also extends into studies regarding genetics as well as injury or violence. In the modern world, epidemiology is widely used by experts to solve day-to-day health issues across communities. With the ongoing COVID-19 pandemic, the role of epidemiologists has expanded even further. Within a few weeks of the first outbreak, epidemiologists were able to determine the death rate for people over 80, the basic reproduction rate, and the incubation period. During the pandemic, epidemiologists are required to communicate the results immediately with the public, but must do so in a way that is understanding and not alarming. Epidemiologists are now working together across the globe, and researchers from other fields are contributing their own expertise. The pandemic has made finding alternatives to lockdowns a priority for epidemiologists, who now shape public health policies around the world.